Morning, David.
Morning, Les. How are you this morning?
I'm doing pretty neutral this morning. Yeah,
How do you do neutral?
I'm just am right here.
So you're more enlightened than usual this morning?
I don't know, enlightened. Maybe I'm just very peaceful. Yeah, so just right here.
Well, I almost overslept. So here I am. I'm trying to I'm doing a little active meditation this morning to figure things out. The topic this morning sounds a little mundane, and it is for a reason. Is that when I was in college and high school, I learned about meditation and Buddhism, which is a brilliant philosophy, really brilliant. But I always put this in terms of some sort of psychology. Okay, I'm going to calm my mind down, sometimes
Hmm.
psychology deal. And what's happened, and it wasn't until even through medical school, I thought the same thing. It's only this last 18 months or so since I met Dr. Arya, my guru, that we have no, it's about the body's chemistry. It's amazing to me. So as I explain this to my patients, why they have so much clear understanding about what's going on, it just makes it easier. So we're going to contrast this morning a little bit of what's called active meditation or meditation with breath work. And I'm going to set up the stage, and Dr. Arya actually is an expert on this. So you are the guru this morning, whether you like it or not. So you remember you have the input, the nervous system that processes the input or your environment, and then your output. When your stress is overwhelmed, your coping capacity, you go into a threat physiology or fight or flight. So my concept is that the breath work works on the vagus nerve that stimulates it lowers the temperature on the vagus through the vagus nerve, which is directly anti-inflammatory. Meditation sort of allows your brain to be with things. It trains your nervous system to changes your nervous system. And then mindfulness to me is a little bit different because you simply switch sensory input. So if you have racing thought, you just go to a sound or a taste. We did this a lot during surgery, that as we simply switch sensations, all these racing thoughts started to disappear. And so that's my rookie assessment. And now
Yeah,
Dr. Arya will tell us exactly the way it is.
yeah. I think, David, it's a great topic. A lot of people misconstrue meditation and breath work, but they have some very strong overlaps and very distinct at the same time. Yeah, let's start with breath work. Breath work, the reason I prescribe it and the reason I practice it, for example, the moment my eyes open in the morning, I basically have one hand in my chest, one hand in my belly, and I take about 25 breaths. And as I'm just kind of noticing the rise and fall of my breath, I'm simply feeling it and intentionally slowing my breath down. Because very often when I wake up in the morning, I have about, like both of us have this, is where we have about, 1,000 things to do and emails and phone calls, and it's just on and on and on, right? And my stomach
Talking to each other.
tells each other, right? At 6:30 in the morning.
Right.
Right. So sometimes when we awaken in the morning, our cortisol sometimes might be rushing, like I've got to get on to the next thing. For some of you, it might be I've got to get going with work, children, caretaking for someone. It could be a variety of things, and your body gets charged up. And so breath work is prescribed intentionally to lower the threat, the danger, and the threat response system, basically the stress response. So breath work is intentional manipulation of the breath to stimulate the vagus nerve. The vagus nerve is very important in putting on the brakes, slowing things down. It's the vagus nerve is very important in the what we call the rest and restoration. So the body can heal and the mind can heal, whether you have depression, anxiety, chronic pain. But if you're constantly overreacting to thoughts and body sensations, breath work is a great way to put the brakes on. I just want to check in with you, David, before I head over to mindfulness and explain the difference.
Yeah, just understanding that the vagus nerve is what's being stimulated directly. It's anti-inflammatory, it slows down metabolism.
Yeah.
The vagus nerve goes to every organ in the body. So again, you're directly affecting the physiology, and is of course very simple and very effective. No, I'm excited about this whole new set of concepts.
Yeah, and it is. And it's so simple yet complex. It's so powerful yet boring. So, that's the polarity of our life in some sense. And so let's kind of head over to mindfulness. So
Okay.
just a really quick review here is when I intentionally ask my patients, including, because I don't practice, I need to practice, meaning I need to practice what I preach. So one of the things is I wake up in the morning, I do my breath work, and throughout the day, I actually pay attention to how my breathing rate is. So for example, when you, this morning when we were chatting prior to getting on, I was noticing my breath as you were talking. I noticed it was fast after you said, hey, I kind of overslept it. And I noticed my breath might start to move fast. And I thought, oh my gosh. And so what I did was I intentionally slowed my breathing down, and then everything else slowed down. My thoughts slowed down, my sensations slowed down. So breath work is intentional putting on the brakes. Now, mindfulness, whole different ball game. It's the opposite. Mindfulness is about when, as you talk about the input of the senses coming in. And if we're not separating from what's coming in, we're going to become that sensation, difficult thoughts, difficult emotions, or physical pain. So mindfulness is about being the observer, not the participant. So when you have a difficult thought, difficult emotion or sensation, we sometimes interact with it. This does not mean ignoring the sensations or whatever we're experiencing. Again, difficult thought, emotion, or sensation. It's not about ignoring, it's about getting in the middle of the tornado. It's about observing what is happening versus reacting to what is happening.
Well, just to remind the audience that unpleasant thoughts and emotions are processed the same way in the brain as physical threats. People don't understand that. I didn't either, but I
Yeah.
mean, you have the same effect on your body as a physical threat. It fires up the immune system. It creates white blood cells that actually destroy the tissues. And so it's not a small deal about what thoughts come into your mind. And like you pointed out, you cannot control your thoughts, but you separate a little bit of separation. And I think
Yes.
this is a lesson of that if you don't separate from your thoughts, you become your thoughts. Is that a lesson?
Yep. That's exactly it. And,
Okay.
and that's it's very important. This is why we have, so the message that we are sending our audience and ourselves is this, David, right? We're saying is this is when something, remember this a couple of days ago, I said it, and after meditation, this is when it came about. We're responsible to our mind and body, not for our mind and body. We're responsible to how we relate to this information that's coming in. How do you wish to relate to it? Oh, thanks. So when your mind says, oh, we better get going, this, you're like, all right, thanks for your opinion. When your body is feeling tight, that sounds like you're sensing some sort of danger. It's constantly being aware without getting over identified with it. Let me say that one more time because it's easy to miss this part. Mindfulness is about observing, being aware, being in the middle of the tornado without touching the tornado. Well, how do I do that? Well, that's why it's a skill. And research out of Harvard, Lazarus, and several others have done, and Wake University have done wonderful studies. Here's what they found out: when you practice mindfulness meditation, it is more effective than morphine. What?
Right.
Just 20 minutes of training actually they found was more effective than morphine. That's an opioid, that's a pain medication. And so when people who do practice, people with chronic pain, anxiety, depression, when they practice mindfulness, you reduce, as David loves to talk about this, and there's so much truth in it, is inflammation. When you practice, when you down regulate your threat response system in your body, you actually reduce inflammation, the stuff that the doctor doesn't know why your hands still ache in your body, why you're feeling not so good, reducing the threat response. So mindfulness is a great way to build this muscle inside of you called awareness. So when you practice mindfulness, you change your brain real estate and you change your body real estate. So it's an amazing benefit, very
Well,
powerful.
we could do a full workshop on this, and this is really fascinating. I just will say really quickly, you're directly changing the body's physiology, which is what life is about in a way. And medicine somehow puts us into this psychological construct. They
Yeah,
don't. So to them, the medicines are valid. What's mindfulness? And it's actually the opposite. The most powerful way of healing your body is recruiting your own defenses because it's so powerful.
yeah,
And if you don't
yeah,
recruit your own body's defenses, you're sort of screwed. And so morphine is like just throwing, a piece of grass into the wind. It doesn't work. So let's finish up. So Dr. Arya.
Oh, I can almost, that tone of voice sounds like, hello, Dad. I'm
All
sorry.
right. I'm still recovering from almost missing our program this morning. So give us one breath work and one mindfulness thing to consider today.
Beautiful, real easy. How about we'll do just exactly that. We'll let me have you hold your hands up. All right, take your other finger and do as I'm doing. As you're moving your finger up your thumb, breathe in, and as you breathe out, lower that finger. Feel the sensation as you breathe in, and then out. Breathe in, pause, and then come down. Almost there. Breathe in, pause, and then breathe out. Slow exhalation. In through your nose and out through your softly pursed lips. Done.
So you just did mindfulness and breathing in one move. How'd you do
That's
that?
what I'm saying.
Oh my God.
It's a twofer. I didn't want to tell you that.
Where did that come from? Oh my God. All right. I like that one. That is good because I like to be efficient.
Yes, you are, David.
Which sounds a little counterproductive to trying to relax. But anyway, this is called dynamic healing moments. And dynamic healing recognizes the interaction between the stress and who you are and what results. And so Dr. Arya just gave us a very dynamic maneuver this morning. Thank you, Dr. Arya. And so Dr. Arya can be reached at remedypain.co, and I can be reached at thedocjourney.com, and have a really relaxing day. But honestly, use the tools today.
Yeah, try this.
Mindfulness, really watch what happens. It's a huge factor. So anyway, thanks everybody. Nice to see you.
Take care, David. Bye, everyone.